So today we're going to do a ultrasound facelift on a client, and this is going to tighten her skin up all over her face, take any of the wrinkles out of her neck. We're going to work on the crow's feet, the number 11 on her forehead if she has one, and also some wrinkles on the forehead. This singular treatment should show instant results, and the beauty of these treatments with the bipolar and tripolar modality heads are that they will generate additional collagen building for the next 3 months. So even after this first treatment, she'll look better in 2 months than she'll even look today. When we put together a package usually of 4 to 6 facial treatments that they usually come in for once a week, and that's the therapy phase, and then for the next 3 to 4 months you've got nothing but collagen building and youth regeneration of the cells in the face. Quite amazing how it turns out. One of the things I'm going to do today is I'm going to use gloves. We are going to use grapeseed oil on her face as a conductor. You never do cavitation on the face with ultrasound gel. But people feel a lot more comfortable when you're working on their face if you're wearing gloves. And in this day and age of viruses, also a face mask is highly recommended. I'm not going to wear the face mask today because it's going to be very difficult for you to hear me. But I highly recommend using a face mask. So the first item on our agenda is to make sure that we cover up her sweater so that we don't get oil on it. Item 2 is to apply the grapeseed oil. So I'm going to put a little bit in my hand. I can feel it, it's chilly. Everywhere I'm going to be doing the treatment, any place where that tripolar or the bipolar head is going to hit has got to have this oil on it, or she will feel sparking. Some of the benefits of this treatment, besides the skin tightening, when the collagen starts to get rebuilt, it seems to have an effect of being able to smooth out any unusual skin tone issues that the client may have. And it's almost always incredibly effective with the pores. So it tightens the pores up tremendously right away during the treatment. I'm going to go right along the eyebrows, and I'm going to actually tighten up the eyebrows and pull them up a little bit off of her skin. So there we are. We're ready to go with the treatment. 2 modality heads we use on the face. One is the bipolar. This is perfect for a double chin, also perfect for the jaws and the jawline, smoothing the jawline out. And if you want to reshape the face and get some of the fat molecules out of a puffy cheeks, this is the tool you want to use. So I'm going to show you how that works. I'm going to do the bipolar. And on the face, we don't do nearly the amount of energy level or the number of minutes. I'm going to do 6 minutes of bipolar on the face, and I'm going to be working on the jawline, I'll be working on the cheeks. And you have to be looking at the client as to what their goal is. If you see what I'm doing, I'm pulling it up in a certain direction. And that's the double chin area right here. If you're working on the neck, you never shoot right at the voice box. Your thyroid's right behind it. We do not use radio frequency anywhere near the thyroid, so you have to shoot away from the voice box. So I'm just going to do a little bit down here for tightening. And when you're first starting out, count 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Do it to the other side. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Now the reason you want to do that is make sure that the skin is even on both sides. Also, you don't want to keep going over the same spot over and over again. That amount of energy will start building up the heat, and you don't want that to become an issue on their face. If you try to do 15 repetitive motions in the same area, you have the potential of burning the client, getting it very hot. And that's one thing you don't want to do. So I can see she's got a little bit of a wrinkle right in there. I'm going to work on their cheek just a little bit. Do it on the same on the other side. A lot of people use the pulling technique. They think that pulling the skin actually creates a grain into the collagen. I'm not so sure that's true. So now I'm done with the bipolar part of the treatment. I've sculpted the jawline. I've worked on a potential double chin. Depending on what the client's looking for, you really want to ask them what is their areas of concern, and you try to go back to that area over and over again. If it's a double chin, you want to go back to that double chin and really grind in there and try to get the double chin reduced. And you will see results immediately. So now I'm going to move on to the tripolar, which is a tremendous tool. This one, again, creates the collagen blast. It's got 3 pins to it, namely the tri. And it does have little red LED lights on it. This will tighten the skin and create collagen blasts, and this is the tool that we use to go over the entire face. I'm going to do 12 minutes on the tripolar. And you can see the red LED lights showing up. I'm going over the same area that we did with the bipolar. This modality does something a little different. Going right over the jaw, tighten the skin up, and I'm trying to get an entire coverage on the face. Now when I come to the eyes, if I have a hard time getting, I really can't shoot into the eye socket. You don't ever want to shoot into the eye socket, but I can't get my probes right where the skin is starting to wrinkle. So I pull the skin down a little bit and I run it back and forth on the cheek, and that gives that same effect. For doing the treatment, you can work on the temples, but you don't want to concentrate a lot of time on the temples. The marionette lines, the laugh lines, and now I'm going right across the bridge of the eyes. I'm going to spend some time on that number 11 right there, and you should be able to tell before and after quickly the results. Again, the head's got to be continuously moving on the skin. You do not want it to stop. It has a tendency to burn or spark. If you don't have oil on the place where you're treating, it is going to spark on them. Let's see, I'm working on that number 11 right there. Let's work on the marionette lines over here. And you want to work on the entire face because it will tighten the skin up and close the pores. If you don't work on it, it's not going to give that effect. I don't know if you remember seeing the crow's feet and the wrinkles below her eye, but that is going away dramatically right now. The forehead, small concentric circles, or you can go straight across and you can go right into the eyebrow. And make sure you still are on bone and you're not shooting into the orbital socket. Now let's take a look at working on the neck. Remember, I'm missing the voice box, so I work on both sides of the neck and not directly where the thyroid is. And then the chin area. A little bit of a double chin there, not much. So the face, you're working on a fairly small amount of real estate on the skin. So you got to keep moving in different locations to make sure you don't put too much energy in any one spot. Now she came in with makeup on, so she had to remove her makeup. You want a clear, bare skin to put the grapeseed oil on. And then you want to have her clean her face afterward, or you dab the oil off. The grapeseed oil is the conductor for the technology to be able to reach into the skin, close the pores up, shorten the collagen fibers. Are you feeling any sparking? Cha-cha. You feeling any sparking?
A little bit.
Nothing?
A little bit.
A little bit? Okay. So, she's feeling a little bit of sparking. I'm going to stop the treatment. I'm going to put some more oil on her face because she should not be feeling sparking. So you got to continuously ask. You have to continuously ask the client how she's feeling. And women are pretty good about this. They've so we got a new coating of grapeseed oil on. We're going to be back at it. See, right along that jawline, you can get your tripolar right in there to tighten up that skin. Again, I pull down the skin to get access to the wrinkles on around her eye. Just a little touch up around the temples, not too much. We've had clients want to have 40 minutes on their face, and you just can't do it. It just is too much energy into the skin and around the cranium. So the most you want to give them is between 10 and 15, maybe 17, 18 minutes with the two modalities, the bipolar and the tripolar.